we've learned from you, Bob, especially over the last 2 years, is that the Labour Party is as dangerous to the health service as the Conservatives. Do you think they're actually more dangerous in a sense?
Well, if people are falling for the line that somehow voting a Labour government in will save the NHS, yes, that's very dangerous. The public need to understand that this is actually a joint enterprise. Tory, Labour, Lib Dem have all signed up to changing our NHS to a logo and a funding stream to be controlled by American corporations. So they're all in agreement. And, you know, unfortunately, we have an instinct to trust people, and they keep feeding us with lies that lull us into a false sense of security. Unfortunately, just because there's an NHS logo there does not mean that is the NHS as we understood it. Behind that logo is now a totally dysfunctional, toxic, and corrupted health system, which has been repurposed to extract profit. Now, Starmer and Streeting have made it clear that, you know, the only difference between them and the Tories is they want to go down that road even faster. They've said it themselves. They want more dealings with the private sector. They want more reform. And that reform, what that means is downskilling, replacing doctors with non-doctors, reducing staffing levels, and cutting service provision. That's what they mean about reform. We mustn't keep falling for the same set of lies just because the faces fronting the lies are different. They are taking us in a very dangerous direction, irrespective of the party that people choose. And that's where the public may be lulled into a false sense of security. And that's what happened with Tony Blair in '97. 7 days to save the NHS. Remember that? Well, he spent 13 years dismantling the NHS, in particular with toxic PFI liabilities, further embedding the market, and for the first time ever in the history of the NHS, outsourcing clinical services. He has removed the principles of the NHS, and the Tory Lib Dem coalition just built on that. And, you know, the final nail in the NHS coffin in terms of legislation was hammered in last year with the creation of American-style managed care legal entities, which called integrated care systems, which will have the independence of running a public budget, and any surpluses can be extracted as profit. And surpluses are by keeping staff wages down and denial of care. They are the fundamental tools for extracting profit. Denial of care means letting people die.
Morning. Nicolas, what do you want to add to what Dr. Bob said?
Yeah, I was going to talk about something quite similar. So the focus isn't about Starmer in particular. We're talking about change of faces. It's about what institutional policy is and whether there are, you know, significant differences between the parties. And at the moment, policy is set by, you know, has been set over the last decades, mostly by NHS England, this entity created by the Andrew Lansley Act. And the sort of the thing that would have told you where Labour stood on it was what its attitude was to that policy. Because the real problem is that we had all these policies under New Labour. Bob referred to somebody, essentially a policy that was overall about institutionalizing, copying basically what the US government does. Is US state policy in Medicare and so on, to have a minimal system and maximum opportunities for business. And that's what it was being talked about actually quite a lot by the left at the time in the 2000s. And it's really worth going back to a lot of the stuff that was being written by, you know, Seamus Milne was writing about managed care, which Bob talks about, which is what we're talking about, which is the ICSs, what the system that's copied from the US that reduces, talk about denial of care or cutting services. It's the same principle of reducing the public in ways that expand the private. Where Streeting has said very clearly that they would continue the ICSs and develop on them. So that's that direction of policy. It's reduced, that's what they do. They are financially rewarded for denying care, cutting back services. So you see the diagnostic centers that were recently announced by Rishi Sunak, but that were not his invention, they're part of the NHS long-term plan, presented as being about preventing cancer, but they are extracting the profitable bits from hospitals that are being closed down and downgraded, which was happening under New Labour. And the point is, people on the left were quite sharp. One point is about all of this during New Labour. And then, from my understanding, is that around the time of the Health and Social Care Act, Andy Burnham came up with a discourse that made it sound like, oh, we're hearing old Labour again, sort of a big differences between the two parties. But what he was proposing was really a whole repackaging of all that stuff that we'd seen. And I'd add, New Labour was moving to handing over budgets to US companies, and all the other stuff I talked about. He just repackaged that as merging health and social care. He didn't invent that, but he made a big thing of it, being about merging health and social care. And that is the way that this US system has been presented in British politics, not just English politics as well. So I think we just need to be very, very clear. We're talking about, yes, a cross-party commitment to the same policies. And it's important to understand those policies. And so the big difficulty was, during the last decade, having anybody speak out about what the Tories were doing because they agreed with it. How could you have a major opposition party even telling the public what was going on? And that's why Jeremy's election was so important for the NHS. However, that was undermined by the fact that we didn't have a left-wing shadow health secretary for most of that time. So what was said about what the Tories were doing was not a scratch on what they were really doing, because it wasn't touching on the fact that they've institutionalized a whittling away from health service that we're seeing the effects of now, which is simply going to continue. So I say, rather than, it's not so much on Starmer, but it's about recovering sort of intelligent understanding of evidence-based understanding of what policy is actually doing to the service, and not reducing it to bad Tories underfunding.
Can I just come in a bit there, because I put on the description of you coming on the show. I put the
that's a good point. Yeah,
in the SHA, right?
Yes.
Now I got a text from someone called Mark Ladbrook.
He's the chair of the SHA. Yeah.
He says, Mark Ladbrook here, chair SHA. Since 1931, the SHA has been a Labour affiliate. We believe a Labour government is an urgent necessity. We cannot and do not back candidates standing against Labour. Now, this is a bit like something we've spoken about, Bob, before, with the health service unions not speaking out because they've got some kind of affiliation, or there's some kind of, I don't know, bureaucratic problem with saying Starmer and Labour are doing the damage, will do damage to the NHS. I mean, what do you want to say to that, Nicolas? And then I'll go to Bob.
I'll just say, I mean,
do you think there's a problem with a lot of the groups around the NHS not calling it out?
Can I say, just on the SHA, there was some worry from Mark about, whether this would be presented, because you mentioned I'm part of the SHA, and I am, as the SHA position to support Stop Starmer, and it isn't the SHA position to support Stop Starmer, so I'll just make that clear. The SHA has called for Labour. No, I'm just making it clear because that's the official position. The SHA's official position has been, and I've been part of saying that, to demand Labour oppose ICSs. Over the last 5 years, every conference has demanded that, and it's been ignored every single time. I'll throw that in, because that's not compatible. Having ICS is not compatible with having an NHS. But there is also definitely an issue about emotionally what people associate with what. It's like what Chomsky said that about, centre-left Labour parties in the world in general, that they can tend to get away with things that right-wing parties can't, in the way that Bob describes, slightly, roughly that way. I'd say, Obama can get away with things that Bush and Trump could not, or Biden can, that are worse, because there's this image that they actually represent. And there's a double standard. People talk about the same policy and they say, the Tories are doing this because they're bad, but Labour are doing it because they're cowardly and they're giving it into the right-wing press, and they invent all sorts of excuses on the left for it, when we're actually talking about the same policy for the same interests, just funneled through different, different. So it was a wake-up call what happened in the 2000s, but I think we need to wake ourselves up quite a lot before then, because there's been quite a lot of sleeping away, actually, I'm afraid, in terms of facing up to yes, the fact that there is a cross-party consensus against the principles of looking after everybody's healthcare by the state, and Jeremy was really the exception to that.
Now, Bob, what's your response to? I mean, you've said this to me as well, that a lot of the groups that could be saying stuff and fighting against these reforms that have killed the NHS effectively, or just privatise the whole thing, no one's speaking up. What's your response? How can we turn those groups around to say, no, we're going to call Starmer out?
Well, just imagine, why should these groups be any different than the Labour Party? You have lots of good people within them, but the right wing tend to be more ruthless and savvy and assume the positions of power. Within the SHA, there's a gentleman called Dr. Brian Fisher, who I got to know through the Save Lewisham Hospital campaign, who personally has interest in private healthcare. And he was formerly, I believe, co-chair of the SHA. You couldn't make this stuff up. Yeah,
right.
So you couldn't make this stuff up. You have somebody who's earning money from privatized healthcare in the echelons of the Socialist Health Association. This is insane. When Corbyn was in power, all these groups, the People's Assembly, Keep Our NHS Public, all the health unions, didn't do a thing to extend public understanding of what's happening to the NHS. All they drone on about is more money and Labour's better than the Tories. That's not good enough. They are largely responsible for the imposed ignorance of the population. Yeah, I've spent a decade trying to get this message across. It's not a complicated message to tell the public that our NHS is being taken over by American corporations and will be run like an insurance company. That's not a complicated message. Yet all these organizations have failed to make any impression in the public conscience. Now, either they are supremely incompetent or there's something else going on.